fighting the epidemic, the new infections, the young people living with HIV, our executive mayor, members of the Memorial Committee responsible for health and councillors. We present to you all this day. I'm sorry, I'm running out of breath because I came in a rush. Firstly, I'm overwhelmed by today. We had a visitor, a very special visitor at my home. We had Bomama coming to visit my home this morning. And I said to Mr. Moyepi, I feel like the day could just end. My day is okay, my day is complete. I could just go back to bed and take my medication more motivated and knowing good and very well that I've got a brighter tomorrow, living with HIV. So, our leaders, I thank you for honoring this day. I normally say HIV is not for the 1st of December only. HIV is every day because we live with this chronic every day. I don't call it a death-threatening disease now. I call it a chronic that we can overcome. A chronic that we determine as to say, how are you going to live with it? The same as the disability. Disability, I think when I came in, you all saw that I was in crutches. 5 months back, I was in a wheelchair. But who determined how she wants to live? It was me. And I normally say, the woman in the mirror is what makes you. So when I wake up in the morning and I feel all hope is gone, I always look for my mirror. My daughters know and they will say, but Mama, how can you what your determinations are, and you shall conquer. As I go back to the speech, today I remember Mama President David, a very strong, determined, committed woman that had introduced me to this world of HIV. I remember when I first saw her, she said, young lady, what's wrong with you? And I laughed. She said, wow, your smile brightened up the whole day. Can I smile for you? Should I stand up and smile for you? Now, where do we see HIV? Do you see HIV in the smile? You can't see HIV. Can you see meningitis on the smile? You can't. That's what makes you. Mr. Deputy, did you see the HIV on the smile? Mr. Steve is also one of the people that I live with. Do you
I can see you are getting agitated, you're standing up. Sit down.
Okay, thank you.
Yes.
Thank you, Deputy. That's the determination. I I told my mind I could stand up. I'll just follow protocol. Today, I'm excited to see everyone in this tent honoring this day. But my plea is to have World AIDS Day every day. We have young people becoming infected on a daily basis, yet we are there. Giving awareness, and we just don't understand why are we having new infections every day. My plea also is that support is everything. I am where I am today. Yes, I'm very outspoken, and when I want a thing to be done, I want it to be done. But without support from even the health workers, you know, I can knock at my doctor's office, Dr. Van Rensbeck from Tipo. I can knock at her office and say, Doctor, I am hungry. How am I going to take my medicine? Say to me, you don't have an appointment. She quickly asked, honey, do you need food for now or do you need groceries? And that's the support I am getting, and that's the support I am pleading for our fellow people living with chronics. I'm not just talking about HIV. Yes, it is a World HIV Day, but I'm talking about the chronics out there. Ratoka support from the leadership. Re kopa hore ke kopa go bua Setswana. Re kopa hore ha re kokota go menyakong ya lona, be go sa thwe re emele ntate deputy o sentse ile Italy, Steve Litsike o sentse ile America. Re kopa go thusiwa with immediate effect, because when we come back to the civil society, we need to come back. What am I bringing to our people? What am I bringing to the clinics? I don't want to bring pamphlets. I'm an activist. I don't want to bring pamphlets to say I was at that meeting. I always fight for it. But to community, in order for them to finally believe in the finding the cure of HIV or living longer with the disease. Thank you very much.
Please stand up for hand, clap hands. Let's give a round of applause.
Where is the other one? I met them two.
Round of applause.
Millicent. Yeah. She's inside.
Call her.
Thank you.
Can we get Millicent in stage?
Millicent.
Can we get Millicent on stage?
Okay.
Let me see for social development.
Who said? She's behind.
Let me see for social development in the house.
You can use this one to pay. You can use this one.
Yeah.
Thank you very much. We can take our seats. Well, these two ladies, why I'm standing up, I visited the house. I visited them. There were two. And I made a commitment when I met the two of them. So Millicent is not here. Can I request Millicent?
She's with Missing for Social Development and SABC outside there.
Okay. But there were two living with HIV and AIDS. And when we spoke, well, a young child, come, there's the child. Her daughter, there's the child. Come this side. Then she said to me, I've got a request to make to you. I'm told you are being called Deputy President, so I've got a request to make. And the request is that you must find my mom a job. And you must build my mom a house. Well, I decided today, because her mom, she's living with HIV and AIDS. She's going to be employed in our office. She's going to go out there and tell our people that they must go out and test, they must know their status. She will go out there and tell our people to take their treatment and stay on treatment. So she's employed from today. And Millicent, she's employed also. Because in our approach, we must be practical. You can hear that when they talk with passion. And these are the messages that we want to hear. So, I'm not going to renege on this promise. The house and your employment. Mom will be strong, and I agree with all of you that we will overcome. Thank you very much.
Now, you can lead the children, and please take care. Round of applause. A round of applause. I recognize that we have the chair of the AIDS Conference 2019, Professor Mafuya. Can you stand up? And we are joined by people who are leading the visits. The Deputy Minister of Social Development is here. Deputy Minister. My colleagues, MEC, who were not here when I introduced others, please stand. You were in the visits. Kihakilwe and Tlapi. Thank you very much. Can we now call on stage civil society SANAC, led by the SANAC Deputy Chair, who's co-chair of SANAC, Ms. Steve Litsike. Clap hands. Steve, let's clap hands for Steve. Steve, 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 Steve.
Hoyaruna, 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 aremele, yaruna. Lisang makwala acheche, acheche. Bapilutet. Oh, Yarona.
Oh, Yarona. Oh, Yarona. Bapilo tse thata ko. Oh, Yarona. Oh, Yarona. Oh, Yarona. Bapilo tse thata. Oh, Yarona. Oh, Yarona. Oh, Yarona.
Viva Northwest, viva! Viva people living with HIV, viva! Viva people with disability, viva! Viva traditional leaders, viva! Viva Sangomas, viva! Viva LGBTI, viva! Viva sex workers, viva! Viva women, viva! Viva men, viva! Viva faith leaders, viva! Viva young people, viva! Viva leaders, viva! Amandla! Amandla! Thank you so much. Program Director, who's the MEC of Health in the Northwest, His Excellency, the Deputy President of South Africa, who's also the Chairperson of SANEC, Mr. David Mabuza, Minister of Health, Dr. Mkhize, Ministers and Deputy Ministers in the House, Honorable Premier of Northwest Province, Mr. Mokgoro, MECs here today, Makhosi Aruna, led by Khosi Mabi, who's the House of Traditional Leaders Chairperson. A very special warm welcome to the United Nations Joint AIDS Program, who's the Executive Director, Mewini. You are welcome to South Africa. And we appreciate to make your first World AIDS Day event with South Africa. So thank you so much. Let's clap that hand because we are special as South Africa. The Deputy Chairperson of Civil Society Forum, Comrade Ndugu, national sector leaders who are members of SANEC plenary, provincial co-chair of the Northwest AIDS Council, Mr. Binambi Mano, and members of Northwest Provincial Council, Dumelang, representative from labor, from private sector, SANEC Trust, development partners, comrades, friends, colleagues, good day. Today is not just an ordinary day, it is the day we come together as South Africa. Today we join millions of people across the globe to mark and commemorate World AIDS Day under the theme, Communities Make a Difference. We come together in our diversities, determined that the epidemic cannot be overcome without a coordinated and concerted effort. We come together with a clear understanding, with knowledge and experience that the epidemic is not merely a health challenge, but it is all our responsibility. It is the challenge with profound social, cultural, and economic consequences. We know that it cannot be done just by government. We know that it cannot be done just by civil society. We know that it cannot be done by development partners. It can be done when we all take a collective effort in the response. Deputy President, we understand our long history of multiple struggles. As we are here today to remember many people living with HIV who stood up many years ago when our government could not give treatment. We remember those days. We come from that long history. We lost many people. But along the way, we realized as a country we need to do better. And we did better. And today we celebrate over 4.9 million people who are on treatment. And we celebrate because they are alive, we are all alive, and we are part of this journey. Deputy President, we understand we can only overcome the epidemic with the full support, one which is the political will in all levels. Like yourself, you have led at national level. We want the premiers, as the Premier of Northwest have demonstrated, to have led and re-established the Northwest Provincial Council on AIDS. And we urge all the executive mayors, all the local mayors, to also do the same and work in partnership with communities and civil society to coordinate the HIV response better. We understand that the agents of change, it's a multi-sectoral effort. Governments, civil society, private sector, and development partners are agents of change in the response. As a country, we have done so much to tackle HIV, TB, and STI. The evidence of reduction of new infections is coming and it's clear. Also, the evidence of putting more people on treatment, as the President had committed by end of 2020, we should have additional 2 million people on treatment. Today, we wish to acknowledge the dedicated effort South Africa has played in the role of leadership in building the foundation that has been laid for the last 25 years. Working with other sectors through SANEC, we have managed to harness unity in confronting the scourge. The amount of resources by our government and development partners like PEPFAR, Global Fund, and many others, we have harnessed the response in prevention work, in treatment and care and support. And these efforts we've seen because they've created change in our communities. But we want to say, Deputy President, much more needs to be done. As per Goal 3, 4, and 5 of the National Strategic Plan, we need to pay attention on social and structural drivers. We need to deal with human rights violation. And we need to focus on key and vulnerable population. Where lives are at stake, we need to be champions of change and not be silent where there is injustice. Freedom was never won lying down. People stood up and fought. People stood up with us and fought with us. Solidarity was found in spaces everywhere across the country, even outside the borders of our own country. We need to learn and extend the helping hand. Deputy President, I also bring to your attention the situation in Zambia, where 2 gay men were sentenced to 15 years in jail because they love each other. Deputy President, the situation in Uganda, where over 100 people, 100 LGBTI persons were arrested as per the attempt also of silencing. The situation in Malawi and in Nigeria, of targeting and smoking out LGBTI community, it's concerning. Deputy President, the lives are at stake. African lives are at stake. It is a shame on these countries that they do not observe their own international obligation, as they are signatories to the international obligations and the Universal Declaration on Human Rights. But it also would be a shame on us if we become bystanders where there is an unjust system around us in our own region, the African soil. Like this theme, communities make a difference. The people will not wait for government. We did not wait when there was no treatment. We had led South Africa. Has stood up with the people of South Africa. We are still also saying, South Africa, it is important to build solidarity. Deputy President, we are marking 16 days of activism against violence against women and children, LGBTI persons, and all people in their diversity. During this period, we remember those who made a difference as communities. We remember people like Simon Nkoli, who died on the 30th of November in 1998. Simon Nkoli was a liberation struggle activist. He was in the treason trial. He was gay and he was living with HIV. We remember Prudence Mabele, who died a year ago, who was amongst us and who was a leader in the people living with HIV. We remember Gugu Dlamini, who was stoned to death in KwaZulu-Natal. We remember many more people who died. And today, as we stand here, we say nobody must die, like all of them have passed on. Deputy President, we have no choice but to deploy every effort, mobilize every resources, utilize every skills at our national possesses to ensure that we prevail. Where there's corruption, it must be rooted out. Where there is incompetency, it must be rooted out. We cannot allow where AIDS Council secretariats are not functional in local level, in provincial level, and even at national level. Where there's incompetency, we must get rid of incompetency. Deputy President, communities, NGOs are part of the response, as you know. And we want to say transformation is key. Investment to local groups is key to part of the response. Minister of Health, we have made a commitment as SANEC, civil society. National health insurance is needed now more than ever. It is important that our health system functions so that people can access health services that are very much competent and that are functional. So we want to say to you, Minister of Health, please ensure that NHI is in place faster. The Premier of Northwest, we want to commend you. We want to commend the MEC of Health for heeding to the call of re-establishment of the council in the province. Within 2 months, Northwest was able to deliver. Northwest was able to deliver and re-establish Provincial Council on AIDS. So we really do commend those efforts. Deputy President, our biggest concern is the comprehensive sexuality education, which is being challenged by religious bigotry. We are saying it is a program and curriculum that has been implemented since the early 2000s. We are asking that we safeguard comprehensive sexuality education, that this must never leave the school curriculum. It must be safeguarded because it's part of our school health education program. Deputy President, decriminalization of sex work. we have committed as plenary, and we are calling the country to fast track what could help us in the response. Moving forward, let me emphasize the importance of accountability because it's very much important. Accountability not only just for government, but for civil society, for development partners, and as well as all community members. It is very crucial. We urge all of us to take responsibility. Thank you.
Thank you. Thank you, thank you, thank you. Can we now call the message? Can we call a message from UN family? Miss Winnie Bianyima, UN family. Let's clap hands for UN family.
Thank you very much. The Deputy President, the Minister of Health, other ministers and deputy ministers present, the Premier of Northwest Province, MECs, comrades here, all protocol observed, Dumela. Kunjani. Thank you very much. I'm humbled and excited to be with you here in Orkney, in Northwest Province of your beautiful country, South Africa, to commemorate World AIDS Day. Thank you for the warm welcome to the heart of your community. On World AIDS Day, and indeed every day, as a young woman said here, we remember the millions of lives lost to HIV over the last 40 years. More than 3.5 million of them here in South Africa. Lives lost to despair, stigma, and exclusion. We also celebrate the struggles and the resilience of those alive today because it has been the huge progress that the world has made against the epidemic. I want to start by paying tribute to your liberation movement that started in townships here in your country. Your struggle inspired and moved the whole world to action to end the evil system of apartheid. Amandla. Yeah. The eyes of the world are once again on South Africa. You started late, but today you are making remarkable progress against AIDS. More than 5 million of your people living with HIV are now on antiretroviral treatment. That's 20% of all the people on treatment throughout the world. That's remarkable. You have reduced the number of AIDS deaths in the last 8 years by 53%. HIV incidence, the number of new infections, you've cut that down in the last 8 years by 44%. Great progress. But yet, we cannot rest. We, your friends and yourselves, we are still on a journey. There are almost 2.5 million people living with HIV who are not yet on treatment. There's a job to do. There are more than 1,400 new infections among adolescent girls and young women every week, 1,400. That's intolerable. So today on World AIDS Day, here in South Africa and around the world, let's commit to overcome the challenges, the barriers that we face. Governments around the world committed to end AIDS by 2030. That's about 10 years from now. We must keep that promise. But we can't keep it by doing business as usual. So let me give you 5 things that we must do faster, be more focused on in order to beat AIDS by 2030. First, we can't beat AIDS unless we make huge progress on the rights of women and girls here in Africa. We have to. It's unacceptable that HIV is the leading cause of death for women between the age of 15 and 49. 15 million girls worldwide have experienced sex that is forced at some point in their life. There lies the cause. 3 billion women and girls in countries where there is rape within marriage and it is not a crime. How can that be? Enough is enough. All women and girls must have the right to choose if they are going to have sex, with whom to have sex, and how to protect themselves. So let's bring power of our movements, the HIV movement, the women's movement, the youth movement. Let's bring our power to end gender inequality and violence against women and girls. Then we'll beat AIDS. Second, to protect the human rights of all people, to end marginalization and the terrible injustice of AIDS-related deaths. We can be proud that 24.5 million people in the world are now on treatment. But we can't accept that every year, or last year, 770,000 died of AIDS. We can't accept that people living with HIV should be dying today in 2019. It is not a question of the science. It's a question of inequality, of powerlessness, of exclusion, and that we can change. The system can now work for millions of people living with HIV, but it's failing for those who are marginalized. Gay men, men who have sex with men, transgender people, sex workers, people who use drugs, prisoners, foreign workers, and migrants. All these are people on the margins, and they are the ones where new infections are rising fastest. So, social injustice says human rights violations must end for us to beat AIDS. On World AIDS Day, I call upon all countries to repeal laws that discriminate and criminalize groups of people, driving them away from life-saving services. Third, we need to put science and technology to work to save lives. The world has spent billions of dollars developing the fastest tests, the best treatments, new prevention technologies such as PrEP, and other methods that women can control. Let's put them to work in every community, in every country. Here in South Africa, your progress to the target of 90-90-90 is impressive. 90% of South Africans living with HIV know their status. They've tested. That's good. 68% who know their status are on treatment. And of those who are on treatment, 88% have undetectable viral load, meaning that they can't transmit it. That's good progress. I'd like to commend some districts here in South Africa that have actually hit the 90-90-90, and we celebrated that a couple of days ago. But think about it. If there were no rapid tests, would you have your first 90? What about the second 90 of being on treatment? Would you achieve it if you are waiting for months or years for treatment? You couldn't. What about viral suppression? If you're still using those old tablets where you swallow 6 or 12 instead of one fixed dose combination, one pill. So science has been important. We want more science, more innovations to take this struggle forward. So I call on every Ministry of Health, every National AIDS program, every community to be bold and quick and get on the fast track. Let's put science, innovation, technology to work for people. Fourth, communities. Communities, communities, communities. That's the focus of UNAIDS report this year. On Friday, comrades, I visited Block X Clinic in Shwane and met there amazing people living with HIV. I saw how the Rishidze project with 5 leading HIV organizations under the leadership of TAC, how they are unleashing the power of communities, empowering people living with HIV to monitor services and to hold officials accountable. I see my time is running. So we can spend a lot of dollars and rands building clinics, but we will not make progress unless communities can hold their deliverers, service deliverers accountable. So empower communities. Finally, financing. We will not beat AIDS by 2030 without the resources to do this work. Yet, our region, Africa, with the highest burden, is facing serious financing challenges. There are many, but let me name 2. One is actually the issue of declining domestic resource mobilization on the continent. We are failing to raise the resources that will pay for health care. And without raising enough resources, we will never own our epidemic. Thank goodness in South Africa, you've made tremendous strides. 80% of your resources, of the resources for the response, come from your own people. That's important, but I call on the rest of Africa. The second big issue is debt. We have been borrowing, and now the chickens have come home to roost. Many of our countries are now entering programs of austerity, cutting health in order to pay debt. This is bad. This is wrong. Vulnerable people living with HIV must not be made to pay the price of this financial debt crisis. It's wrong. We must find ways, pathways out of debt that protect investments in health and in HIV response. UNAIDS stands ready to work with African countries to find those pathways. Lastly, for the donor community, AIDS is a shared responsibility. Do not roll back. Do not walk away at this time of need. Continue investing the resources in health and in the global HIV response. I end by saying, comrades, we can beat AIDS. Just like you beat that evil system of apartheid, we can beat AIDS. We need to focus, we need to work harder, we need to work faster, but we can beat AIDS. Thank you very much.
Thank you. Thank you. Forward with international solidarity, forward. Forward with international solidarity, forward. Can we then welcome on stage the Premier of Northwest, Professor Job Mukgoro, to speak words on behalf of the provincial government. Over to you, Prof. Matsoho.
Thank you very much, Program Director, His Excellency Deputy President, the Minister of Health, Dr. Zweli Mkhize, the MEC for Health, and other MECs here, Deputy Ministers, the Kgosi tsa rona,
Bagaetsho dumelang. I'll be very brief in the interest of time. You have been told several times that we have managed to re-establish the PCA, the Provincial Council on AIDS. And our commitment is to ensure that the entire structure throughout all the levels in the province will ensure the appropriate political leadership. We will ensure that the stakeholder participation that is necessary takes place, stakeholder management takes place. We'll ensure that the necessary institutional and organizational collaboration against the system happens, but more specifically, we'll ensure that the resourcing of the PCA is something that is real. The second thing that we think we are required to do in our policies to make sure that we lay more and more emphasis on behavioral issues. Matters such as beliefs, such as attitudes, such as mindset, especially if you look at gender-based violence, if you look at programs for youth development and employment creation, because we believe that a lot of the youth become victims of gender-based violence, they become victims of sexual misconduct, especially by adults, and as a result, we get more and more new infections joining the queue. So that in a nutshell, Program Director, and in a very, very practical sense, our large focus is going to be the effectiveness of the PCA. Our focus is to make sure that in our programs, we do what it matters to influence behavior, to infuse behavior in our policies, particularly targeting young people with regard to their development, but more importantly, with regard to youth employment. Thank you very much, Program Director.
Let's clap hands for the Professor. Premier, thank you very much. We've recognized Honorable Musinogi MEC for DDECT, but we're also joined by Colonel KG Kihakilwe, Commanding Officer, Area Military Health, Northwest, who's also representing the Lieutenant General Dabula, National, who's not here. You are welcomed, Colonel. Matso for Military Health Service. Thank you very much. Now the program is as follows. The Minister of Health will come here. When the Minister of Health calls the Deputy President, Imbongi will stand. When the Deputy President finishes, the UKZN, Zululand, University of Zululand, ni behave, niziphathe kahle nihambele, ziphatheni kahle. I-University of Zululand izawube ikwelitala kwesi stage, i-conductor or i-manager yayo izoza ngapha izothatha isipho esisuka ku-Deputy President, sipho eso owayesipromise e-KZN kwi-World AIDS Conference ngenxa ye-performance ne-message yekwaya ye-University of Zululand. Wayipromisa u-Deputy President akahambe epromisa angenzi. Uba uyapromisa uyenza emveni koko. Ku-Mr. Delivery ujoyinile ku-President kwi-program kakhawuleza. Le nto nizayinikwa niyisebenzise for i-message. Minister of Health, Dr. Zweli Mkhize, on stage.
Program Director, MEC Sambata. Thank you. His Excellency Deputy President Mabuza, the Premier of Northwest, Professor Mkhoro, the Deputy Ministers, Honorable Pasha, Ukupane Zulu, and Pinky Mloi, the Executive Mayors of Dr. KK District, Councillor Barre Musiane Sekhoto, MECs, Members of Parliament, Members of the Provincial Legislature, Mayor of Matlosana, Councillor Khaile, Hoshi Mabe, and the members of the House of Traditional Leaders, COSATU representative, the Secretary, Mr. Kupano Kunopi, SANAC Deputy Chair, Steve Litsige, and the Chairperson of the Civil Society, Mr. Ndugu, UN Undersecretary and Executive Director of UNAIDS, Ms. Winnie Biamyema, and other members of the UNAIDS family, UN family, the UN Deputy Chief of Mission, Mr. David Young, representatives of PEPFAR, Global Fund, Health Executive at Harmony, Dr. Tumi, representatives of people living with HIV and AIDS, our international partners and local partners, civil society, managers at health and healthcare workers, members of the media and the community. Today there's a very special World AIDS Day. We believe that the winds of change are blowing in our favor. We are now sailing into a direction where there's a future where HIV transmission is showing evidence that is stagnating towards the end of the epidemic. This is a tale of global solidarity and multi-sectoral collaboration where nations come together with one common purpose, and that is to fight and defeat HIV and AIDS. However, there's a lot of work that still needs to be done. We can't beat this disease and all the social determinants of diseases that are associated. We have to embrace the national health insurance and make sure that we create a very strong and resilient system of access to good quality health care, where all of us have got that equal access to quality health care to deal with the rising tide of both non-communicable and communicable diseases. My visit to Klerksdorp Hospital has given me even more hope. This is the hospital where the first patient with multiple drug-resistant TB was treated. They've told us a story of how multiple drug-resistant TB has reduced from many years of hospitalization, such as 7 years, 13 years, to a few months. It does tell us that we're on the right direction. In 2018, we estimated 7.8 million people were HIV positive in South Africa. Currently, 5 million of those are already on treatment, 4.8 in the public sector, and the rest is on the private sector. We're determined to get, by the end of the year, a total of 2 million more people to be able to be treated on HIV treatment. We're also determined to achieve the goals of the UNAIDS of 1990 that we have spoken about, of making sure that people living with HIV know their status, 90% of them, and that those who know the status are on antiretroviral treatment, and those who are on treatment are immunosuppressed at 90%. We are confident that we'll be able to reach this target. Already on Wednesday, we announced 3 districts in KwaZulu-Natal that have already reached the targets. That's the district of Ugu, Mkhanyakude, and Umzinyathi. It's also fitting that we chose Ugu to go and launch a new drug which we call a combination drug TLD, consisting of tenofovir, lamivudine, and dolutegravir. This new innovation has brought in a treatment that has reduced the chances of getting resistance, as well as reducing the side effects and improving compliance of all those who are on it. We therefore are saying now, the scientists, the researchers, the health workers, the patients, the people living with HIV and AIDS, communities, have worked together with government to turn HIV and AIDS, stop it from being a killer disease, to become a chronic disease like any other. That for us is a huge sign of progress. And the message is, no one should die of HIV and AIDS and TB, not today. And we have all the necessary ammunition to stop anyone from dying from HIV, AIDS, tuberculosis, and other related diseases. We need to work together to make sure that all our people are tested. The message is that we must all get tested so that if we are found to be positive, we take treatment immediately so that we can convert to HIV and AIDS from being a killer disease to a chronic disease. All the people that have been treated in the Klerksdorp hospital with multiple drug-resistant TB, most of them were actually HIV positive. It therefore follows that if you can treat and cure someone of multiple drug-resistant TB when they've got HIV, it means we can treat anyone. But it means there is no more reason why anyone should therefore be dying. We will work hard with our partners to ensure that by March 2020, another 14 districts have reached the target of 1990. Unfortunately, none of those districts are in the Northwest province. And I'm making a point and underlying because I want to challenge the community here in the Dr. KK to work with us and maybe prove us wrong and give us a surprise and reach those targets. Right now, Dr. KK region stands at 90, 70, and 85. Of the 106,000 people who are HIV positive, 97,000 know their status. And of those, 58,000 are virally suppressed. And we are here to say to you, you can do it. Let's just go all out and make sure that everybody gets tested and start treatment, because if we do so by March, we will have been able to reach the target of 1990. It is not far, but reaching that target is not the function of the Deputy President, the Minister, the government, or health workers. It is the duty of the entire community. Each and every one of us must go out and fight at that level. We're very grateful today that the Deputy President is going to be inaugurating the Provincial Council on AIDS. It was unfair that this province was left behind with a non-functional or dysfunctional or non-existent AIDS Council. It is important that this council must mobilize the entire response on HIV and AIDS. It is also important that we must work together to support the National Health Insurance, because that is another strong armament in our fight against HIV, TB, AIDS, and all other diseases. Today, we are hosted by the Deputy President, who is the chairperson of SANAC and is the one assigned to lead government response on this matter. Many of us know him as a teacher who was involved in the struggle and became part of the first government in Mpumalanga in 1994, having played a role as an MEC in various departments, education, roads, transport, housing, agriculture, before he became the Premier of the province. We also know that he has been the Chairperson of the African National Congress and has now been elected in 2017 the Deputy President of the African National Congress. Colleagues, friends, ladies and gentlemen, comrades, please rise as we welcome the Deputy President of the States, the Republic of South Africa, His Excellency Titi Mabuza. Ezandleni, matsogo.
Thank you very much. Thank you very much. Thank you. Program Director, MEC for Health, thank you for the opportunity. Our host, the Premier of Northwest Province, Professor Muhoro, Minister of Health, Dr. Zwelini Mkhize, Ministers who are here, and Deputy Ministers, Deputy Chair of SANAC, Ms. Steve Litsike, the Executive Director of United Nations Joint Program on AIDS, Ms. Winnie, who has just left, MECs and mayors, councillors amongst ourselves, members of SANAC, Board of Trustees who are here, our Chair of the House of Traditional Leaders, Hoshi Mabe, thank you for gracing this occasion. Distinguished guests, ladies and gentlemen, Dumelang, Sanbonani, Ninjani. Once again, we meet today on this commemoration of World AIDS Day, not only to remember those lives which were lost to HIV and AIDS, but we also meet to celebrate the positive strides we have made collectively in our fight to end HIV and AIDS as a public threat by 2030. We have chosen to commemorate this year's World AIDS Day here in Matlosana in acknowledgement of the prevailing challenges that are faced by people in this municipality. Our people that are infected by HIV and AIDS and all other social ills that are confronted by our people on a daily basis. I want to thank the leadership of this province, especially the Premier, the MEC, for finally making it a point that we have got the Provincial AIDS Council. Premier and MEC, this is a beginning of a long journey. But I'm happy that you have started this journey. It's a very difficult journey. And now you are going to walk this journey as a collective. You did very well by bringing civil society, by bringing business and government to work together to deal with this problem. We are confident that working together across all sectors of society, the people of this province will join the other parts of the country in taking the fight to defeat AIDS and TB. We are particularly pleased that this year we are joined by the new Executive Director of the Joint United Nations Program on HIV and AIDS, Ms. Winnie, who has just left us. She has given us a message. She is an activist of note, a distinguished advocate for human rights and development. We have no doubt that her vast experience in political leadership, in human development, will take us forward in the struggle to end the AIDS epidemic. For our past as a country, our journey and contribution to the vision of zero infections, zero discrimination, and zero AIDS-related deaths has been long and difficult. There was a time when every week, in every community, the pain of losing someone to AIDS-related illness was a common phenomenon. We are today acknowledged by UNAIDS and others as a global and continental leader in our HIV response. This is precisely because we have implemented progressively and comprehensively all the policies that we've agreed to implement in order to respond to this epidemic. We could not achieve this without partnership and support from all our global partners. That is why we must appreciate the contribution of the global campaign by UNAIDS that galvanized all of us as political leaders, civil society, and private sector into a coherent action. We're also grateful for the unwavering and continued support from our partners, in particular, the United Nations family, the United States government, through its PEPFAR program and the Global Fund. We want to say thank you very much for the support. Your continued support will see us through. We want to say your support is not in vain. We appreciate it, and we commit to work ourselves flat out in order to confront this challenge that is facing our people. What we can assure you is that we are confident that we are going to overcome. As the South African National AIDS Council, we have seen the impact of our collaborative efforts in trying to coordinate our response to this epidemic. And from day to day, we are recording progress. The dynamic leadership of all sectors that are here on the South African National AIDS Council is testament of our commitment to place the interests of our communities at the center stage. We take pride in the fact that as South African government, we remain the main funder of the country's comprehensive response by almost contributing 80% of the resources that we use in our response. Today, we count amongst our victories the fact that South Africa has the biggest HIV treatment program in the world, with more than 4.5 million people on life-saving ARVs. Our antiretroviral treatment program has resulted to an increase in life expectancy of our people and low levels of mother-to-child transmission rates. This means that millions and millions of South Africans who previously had no hope of sustained quality of life now can live longer and are able to contribute in building a country, a South Africa of our dreams. The World AIDS Day is commemorated each year on the 1st of December, and it presents us with an opportunity for every community to unite in the fight against HIV, show support for people living with HIV, and remember those who lost their lives through this epidemic. Placing people living with and affected by HIV at the center of our efforts to defeat this epidemic has proven to be the correct course of action. This is consistent with the theme for this year, which says, communities make the difference. This theme resonates with our history of struggle. At the heart of apartheid and repression, our communities mobilized themselves in various communities to fight apartheid. They built action groups, they built solidarity, cohesion, they built unity amongst themselves to fight the unjust government that was ruling people by repression. Our communities then drew a line in the sand and demanded a just society based on human dignity, demanded a non-racial society, demanded non-sexist society, and a democratic government. Our youth, our civil structures, our media, all of us, we stood firm behind a struggle determined to overthrow apartheid regime, and we succeeded. Likewise, the impact of the epidemic has brought pain and misery to many families in our townships, in our villages, in our communities. Once more, we are calling on our people to stand up, work together, unite against this epidemic. I am confident that as a people, we have managed to win a number of battles. The biggest battle that we've won is our freedom. And this battle is an easy one to win. Community actions, therefore, remains an important pillar in making change to happen, in shaping policy agenda and outcomes. If any of us doubted the power of community action in the making, can look at no further than the community of Eshowe in KwaZulu-Natal. This community, mostly remote, rural, was able to achieve what no other community in South Africa or in the continent has achieved insofar as our fight against this epidemic. In Eshowe, 90% of the people who are infected with HIV were diagnosed. That means they presented themselves, they tested. 94% of the people who were diagnosed with HIV and AIDS received treatment. They are on treatment now. And 95% of those who are receiving treatment are virally suppressed. That means they can live. They are able to do whatever they want to do. They can work, go to work. They can participate in building the country. So this community is the best example. This means that Eshowe has exceeded the 90-90-90 target that we have set ourselves in 2014, which has been announced by the United Nations Program for HIV and AIDS. We once again congratulate this community of Eshowe for this achievement, and I'm sure a number of us can learn from that community, which is a small community, a rural community. In the same vein, I am pleased that a number of our districts are coming closer to reaching the first 90. That means in a number of districts, we are coming closer to 90% of our people getting tested and diagnosed. We are coming closer to achieving the first 90 in a number of districts. Then that means after achieving the first 90, we must get all those people on treatment and ensure that they are virally suppressed. And we're also pleased that the first ever national TB prevalence survey results will be released soon. It's important that we all await those results because it will provide us with a more accurate data on how we are performing in terms of TB. And that survey will guide us on how best we should respond. Indeed, we are making progress in reducing the rate of new infections from an estimated of 270,000 in 2016 to 222,000 in 2018. It's a small difference, but in the right direction. Prevention should be the watchword. All of us must strive very hard to prevent this epidemic. It's one thing to go around, test. It's one thing to put people on treatment. It's one thing to take the treatment for your lifetime. But the best thing is that we should be more stronger on prevention. We have made major progress on voluntary male medical circumcision as an area of prevention, where close to 4 million men were circumcised at the end of March 2019. This is a significant achievement, as these men were not only circumcised, but also underwent HIV prevention programs, including testing. Whilst we make these welcome strides, we must intensify our program on prevention by employing every method available and possible to end this epidemic. We must tackle head-on all contributing factors to new infections. This including taking openly and frankly to our people, especially young girls, on issues of sexuality and the resultant risk of unprotected sex to potential infections and pregnancies. This fight should be led in all fronts. Therefore, political leadership and commitment is required from all of us, from our premiers across the country, from all our MECs for health in the entire country, from all our mayors, district mayors, local mayors. We must all stand up and ensure that AIDS councils are fully functional where we lead. We'll be relying on our communities to take up the task of holding these structures accountable. The call to action on this 2019 World AIDS Day, it's about recognizing the power of communities. Even in the face of other serious social ills, social challenges, unemployment, poverty, and inequalities, our communities are still standing strong. We should not despair. We should not give up. We should forge ahead. We must be inspired to find innovative solutions to ending these challenges, including ending AIDS epidemic in our lifetime. The community actions we are calling for should be about creating platforms for collaborative approaches in how we advance human rights for all. It should be communities making a difference in ending stigma and discrimination against key populations and those infected by HIV and TB. For us to win and end the dual pandemic of HIV and TB, communities must stop stigmatizing and discriminating against those affected and infected by these pandemics. Our call for community actions to make a difference, it's about mobilizing our societies to change their social attitudes, to change their norms, to change their stereotype, some of these stereotypes are a product of how we were socialized as we were growing up. We're calling on our traditional leaders to work with us to deal with the stereotypes, to deal with patriarchy. These are the social ills that continue to bedevil our nation. Now, these social attitudes that are at the heart of the ills we're experiencing today, which breed and perpetuate gender-based violence that is being visited upon women, girl children, the elderly, and other people in our societies. This, we want to say to our communities, this does not represent us. This does not represent Ubuntu and the human rights that were fought for when we're fighting for freedom. And we have committed ourselves when we adopted the new Constitution and the Bill of Rights that we shall be forever, as a nation, protect the rights of those amongst ourselves who are vulnerable. So some of these new tendencies that are emerging amongst ourselves are foreign and they don't represent us. They don't represent Ubuntu. Therefore, we must work and bring to an end any form of violence and discrimination against women and girls, including denial of right to protection, access to treatment and care, as well as the right to reproductive health. We must leave no one behind us, for human rights must be enjoyed by all, irrespective of gender and sexual orientation. Just as we fight to end AIDS epidemic, we should, with equal determination, fight to end the culture of gender-based violence. This gender-based violence is a bad mark to our democracy and to our freedom. Anything contrary undermines our fight to end the HIV and AIDS epidemic. As government, we will work tirelessly to ensure the speedy implementation of the National Emergency Response Plan to combat gender-based violence and femicide. In this regard, we take this opportunity to commend men championing change programs led by the Sanak Men's Sector through the Takuane Rime program. This program is spearheading one of the most robust men's mobilization initiatives in the country to address social ills perpetuated by patriarchy. Every day should be about community mobilization in all corners of our country to ensure that gender-based violence has no place in our society. We call upon men, those people who call themselves men. Do we have men inside the tent? Can men raise their hands? As men, we must say no to gender-based violence. As men, we must continue to love our children, our girl children. As men, we must continue to love our women. I find it very hard to accept that where there's love, there's also violence. I find it very hard to understand and accept that where there is love, there is also violence. Love and violence don't coexist, don't live together. Fellow South Africans, we wish to remind all of you that we launched the Cheka Impilo National Wellness Campaign last year to ensure that together we drive a concerted program that will reach the following targets by December 2020. By December 2020, we want to have screened and tested 14 million people for HIV, TB, sexually transmitted infections, and non-communicable diseases. By December 2020, we want to find and treat at least 7 million people who have diabetes, hypertension, and common cancers. By 2020, we want to initiate additional 2 million HIV positive people on treatment. By December 2020, we must find and treat at least 80,000 people of the 160,000 people that are estimated to be missing and having TB. These targets that I'm announcing will not be achieved without your willing participation. We can always achieve what we are pronouncing here if we work together as a nation. A healthier and a better South Africa begins with you and me. The time to stop losing many lives prematurely and unnecessarily because of not taking the appropriate action early enough, it's now. Let the future generation hail our work as community and health workers in bringing down the curtain on all preventable and treatable diseases. We need ambassadors for change of behavior. Well, today I got 2 ambassadors. I've announced them here. Those are ambassadors that will go out there and call for a change of our behavior. At the South African TB conference in Durban last year, we made an undertaking to donate a bus to the University of Zululand Choir, and I wanted the choir to be our HIV and TB ambassadors, and they've agreed. On behalf of government and the South African National AIDS Council, I have the pleasure to hand over this pass to you. From today onwards, you will be known as HIV and AIDS TB ambassadors, wherever you will be. Even after you have left university, wherever you will be, you will remain ambassadors. Finally, as we prepare for the festive season, we wish to remind all of us to take care of ourselves and act in a very responsible manner. In everything we do, even those things that you do in darkness, be responsible. On this World AIDS Day, let us remember all those who have lost the battle against HIV and AIDS. We must also not retire from reminding ourselves that defeating HIV and AIDS is possible in our lifetime, and that it is our collective responsibility to do so. I wish you, all of you, a memorable and a productive World AIDS Day. Thank you very much. Thank you. I want to go with the choir. Firstly, call the rector, so that we can hand over the pass. Let's hand over the pass, and the pass is standing outside here. There's a paper there. It's a registration paper. Yes.
The writer must come this side.
Thank you. Where's the rector?
Writer, this side.
Yes. Yes.
I will call them as Zoom.
Yeah.
Yes, come this side.
I'll go with these people outside there, then you call it.
Yes.
Yeah.
Thank you so much, TP.
Thank you.
For your work.
Where's the mic? Mic?
I was saying, this is the key for the pass. And these are the registration papers to show that the pass is yours. You can come, let's go and see the pass.
Sing a song to the bus.
Meanwhile,
Maausi, when they go to the bus, you must come and perform.
Meanwhile, we're looking at the pass. I want to see the Provincial AIDS Council. The Deputy Chair of SANAC will call all those names. When I come back, we officially inaugurate that Provincial AIDS Council. In the midst of that council, there will be the MEC and the Premier. They are part of that council.
Excellent. Thank you. Colleagues, while we're waiting for DP to return, I will be calling on all the provincial council. We will wait for the other members to return, but in the meantime, the PCA co-chair, Mr. Pinampi Mano, I'm also calling the members of PCA, starting with the MECs. The first one is standing right here with me, MEC of Health. MEC Desbo Mohono, please also join us. MEC Sillo Lehari. MEC Gordon Kekakilwe. MEC Ginetswi Musenogi. MEC Mapefo Matsemela. MEC Wacheng Molapisi. MEC Buitumelo Muilwa. MEC Motlalepule Rosho. MEC Virginia Klapi. And those representing civil society will also include Mildred Marupefela, Pastor Neo Mwepi, Mr. Temba Hadebe, Mapuleng Sebata, Kibalemo, Mildred.
Join them there.
Yeah. Moving to the district will be from Kenneth Kaunda, Councillor, Executive Mayor Councillor Barei Musiane Sekgotso, Executive Mayor Wanga Kamudiri Mulema, Councillor Tsepo Justice Makolo Makwa, Executive Mayor Boabo Janala, Councillor Fetsang Moluiswa, Molosiwa, and also Dr. Ruth Sekgomotsi Mumpati, Councillor Buitumelo Lesego Mahlangu. District chairpersons of civil society were Kenneth Kaunda, Bright Ndaka, Wanga Kamudiri Mulema, Ouma Mano, Wabu Janala, Ludik Mabiane, Warut Sekgomotsi Mumpati, Warabile Nicodemus. Moving to sector leaders. Jim. Warabile Jim. Sector leaders will start with people living with HIV. Temba Hadebe, Eugenia Kibeni, Solofelo Mohalanyani, Ntsiki Maruping. The LGBTI sector, which is pending a representative here. Sex worker sector, Ntabise Nkhomu. Older person sector, Christina Mataboge. Sports, arts and culture sector, Raymond Masuwe. Faith-based organization, Pastor Kagiso Litlape. NGO sector, Khoitsemang Babedi. Disability sector, Kisebelwang Molwaeng. Men's sector, Reverend Saki Tlotleng. Women's sector, Matlakala Monamudi. Labor sector, which according to NEDLEC requirements, it's represented by a consortium from Kosatu, Kutlang, Letena, Mapula, Mungomezulu. Yeah. Mapuleng Sebata, NAPTU and FEDUSA is still due to nominate. Research sector is represented by Tebogo Sitsedi. Higher education sector is represented by Tumelo Khaihake. Law and human rights sector, Banga Ndlovu. Traditional leaders is still due to nominate. Traditional health practitioners, Musimani Khape Tebe. Health professionals, Mziwake Seleke. Children's sector, Selina Mutswala Tebe. Youth sector, Khape Mojanaha. Mapasika, Moparing, Untirezi, Difuzo, and Lesiho Singwe. The last sector, which is the business sector, Irene Mampa, Ridwan Ibrahim, King Crawford Pilani, Sibonakaliso Mkize, Lizzie Mdoloba. These are members of the Provincial Council on AIDS, and now that the Premier is back, including him as the chair. Okay. Over to you. Yes, they can.
Thank you very much. May we all stand as the council. The council.
Who is the Premier?
Only the members of the Provincial AIDS Council. These are able men and women ready to hit the road running. Where is the Premier? Yeah, the Premier must join because without the Premier, there's no chairperson there. Yeah, there's no chairperson. Okay. I'm happy today to see these men and women. My thanks goes to the MEC. MEC Sambata, thank you very much. And to the Premier. Now, you have got a lot of work to do ahead of you. The first thing that you must do, we want to see all the district AIDS councils, and I've seen the district mayors here. There must be district AIDS councils, there must be local AIDS councils, and we must work together with our communities. The HOA model is the best model. Let's go mobilize communities. Let's get door to door. Let's fight this epidemic. And I'm confident, Deputy Chair coming from civil society, I'm confident that we're going to win. Thank you very much. I wish you well on this difficult journey. Thank you. Thank you.